Hola, ¿cómo están? Bienvenidas, bienvenidos. Estamos aquí reunidos para tener juntos una gran sesión. El día de hoy es para el lanzamiento oficial del nuevo integrante de la familia Anti-Aging Skincare, PCA Skin Academy en vivo y a color desde Estados Unidos. Gracias por estar aquí, conectada y conectado. PCA Skin Academy en vivo con Michelle Goldsmith, directora internacional de capacitación. Va a ser una sesión en inglés, la vamos a luego poner a su disposición en retransmisión en el canal de YouTube Auvernia Oficial y con la traducción necesaria para poder permitirte a ti, a tus asistentes y a tu staff de estar conectado y entendido todo el tema de hoy. PCA es una marca increíble del mismo grupo Colgate Global Health Skin. Tenemos y seguimos teniendo Filorga y ahorita viene el primo de Estados Unidos, PCA Skin, una marca hecha, creada, inspirada y manejada por doctores. Así que estás en el lugar indicado. Gracias por estar con nosotros, Michelle. I'm very happy to have you on board. Thanks for being here. Thanks for joining us here in Auvernia live from the US. I hope the weather is better than on our side. Mexico is freezing now.
Arizona's cold, but dry right now. Yes.
So, just to make a statement, PCA Skin opera desde Estados Unidos, Arizona, muy cerca de la frontera mexicana. Ahí está el headquarters de la empresa PCA Skin. Así que we're close, we're cousins, and
yes, we are.
we love American brands. So, can you tell us more about PCA? Thanks. This is all yours, and thanks to the team, the whole marketing and training team from Auvernia for being here. And any question at the end, si tienen preguntas, por favor, escríbenlas y al final empezamos a contestar varias. Gracias por estar conectado, conectada. Saludos. Have a great session, guys.
All right. Thank you so much for the introduction. Again, my name is Michelle Goldsmith. I am very pleased that you have taken time out of your day to spend a little bit of time with me. And I don't want to take any more of your time. So I want to move forward and introduce to you the products that will be made available to you very shortly, if not already. We are going to discuss back here. Hang on one second. Oops, don't look. Okay, so I'm going to introduce you to our professional treatments and daily care products. But I want to also talk about what sets PCA Skin apart in our industry, and it is our years of experience. We were founded here in Arizona over 30 years ago, developed by a dermatologist. Over 1 million chemical peels of PCA peels are performed around the world every year. We combine multiple ingredients in our peels, which is going to make it easier for you because with blended peel formulas, we don't need to time them or remove them. They simply stay on the skin, which enables those ingredients to stay in the skin longer and do their job versus actually removing them. We blend different exfoliating ingredients. We also have on staff through Colgate, PhD chemists. We have an in-house research and development team, and even though it's not necessary, we make sure that all of our processes are held at pharmaceutical standards. And we have formulations for all skin types and concerns, and specifically the common ones that we see: aging, hyperpigmentation, and acne, and in some cases, even rosacea. Before we move forward, I want to also give you a look at a video that kind of encompasses who we are.
Your skin health matters. In how you feel about yourself. Express yourself. And explore the world. When your skin is not healthy, it holds you back from fully embracing life. That's why, for 30 years at PCA Skin, we created customized skincare from treatment rooms to take-home products based on holistic skin science to transform your skin's health. And why dermatologists and estheticians the world over trust PCA Skin as an ally, recommending our products to transform skin. Our mission is to give you the skin you deserve, so you can fully take on every moment life has to offer. PCA Skin, trusted by experts to transform skin health and improve people's lives.
All right, so just kind of a video introduction about our mission and our vision as a company. And overall, why would you want to bring chemical peels into your practice? First of all, chemical peels have been around for years and years and years and have stood the test of time. There are articles going all the way back to even beyond 1930 of physicians and scientists working with chemical peels. Now, some current statistics from the American Society for Aesthetic Plastic Surgery, they do deep surveys every year. And in 2019, 16.3 million minimally invasive procedures were performed. And this is, you know, your injectables and laser hair removal type devices and things that are done commonly in practices. And in 2019, chemical peels were the third most requested non-surgical procedure. So we go between the third, fourth, fifth, depending on what is going on in the industry. But as I said earlier, we have always stood the test of time. Some of the physiological changes that happen in the skin and why we want to use them is they do provide some destruction of certain components and layers of the skin to help with remodeling and regeneration, to cause, you know, the change without creating undue irritation or injury to the skin. We can treat things that have happened over time, like photo damage, extrinsic and intrinsic aging, and we can also treat chronic concerns like acne and rosacea. Without going through absolutely every single bullet here, I do want you to see what has been proven to take place in the skin when we use chemical peels. We're going to increase epidermal cell cycle, which slows down with age. We want to improve barrier function. We want to elongate our collagen fibers to reorient in more of a parallel fashion versus cross-hatching or cross-linking. We want to activate certain other things going on in the skin. We want to stimulate collagen. We want to stimulate elastin. And so just it all depends on the actual depth of the peel. So even a small amount of peel on the skin is still going to create change. And we have complete control over how deeply the peels are going to go, depending on how many layers of peel we actually apply. And I'll go into how we do that in a moment. So let's talk about the actual peels that you're going to be bringing into your market. We have several. So we're going to start off with a few essential ones that will actually get your practice started. I want to talk about a couple of ingredients that are important to understand, mechanism of action and why we use them. Lactic acid is a hydrophilic molecule, also known as an alpha hydroxy acid. So these are going to help to dissolve the desmosomes, holding those dead skin cells to the surface of the skin. Another thing lactic acid is good for is it's a hydrating molecule. So we're actually infusing hydrating ingredients as we're performing the peel, which a lot of people don't put hydration and chemical peel together in one sentence. It is also a known melanogenesis inhibitor. It suppresses the enzyme tyrosinase, which is part of that melanogenesis process. And then salicylic acid, which is a lipophilic molecule. It's attracted to oil, which is why it's so excellent in treating acne. It's also keratolytic. It's going to help break down excessive keratinization within the follicle. And it's what we call a beta hydroxy acid. Now, this is PCA's modified and enhanced Jesner solution. And Jesner solutions were first developed in the 1940s, 1950s by Dr. Max Jesner. He perfected the marriage of 14% lactic acid and 14% salicylic acid in a formula and put his name on it, hence the Jesner peel. The founder of PCA back in 1989, 1990 took that modified Jesner peel and enhanced it with citric acid and kojic acid. So this is what made PCA who we are. This was the beginning of our legacy, was the development of this peel. So our PCA peel is a combination of salicylic and lactic with the kojic and citric acids added in. So now, that being said, this is an excellent peel for oily acneic skin. It is a good peel for anti-aging and hyperpigmentation as well. However, it tends to be more drying. So this is why we would combine other hydrating ingredients as we're applying this peel. And I'll explain all that in a moment. But looking at the ingredients, this is going to be very beneficial for post-inflammatory hyperpigmentation associated with acne breakouts that we tend to see a lot when they're, happening together. Now that is our modified Jesner. When you are applying salicylic acid to the surface of the skin, chances are you're going to see frosting. And in our industry, frosting and protein coagulation or blanching are sometimes used interchangeably, but this is true frosting. And frosting, as I said, is something you will most likely see with our Jesner peel, and really only something that you see from salicylic acid as it begins to evaporate. It leaves crystals behind. There is no physiological change in the skin when we see frosting. Now we're also going to bring in 2 trichloroacidic acid or TCA peels. So when you see TCA, you think of texture because it's going to denature the protein of the skin. It's going to help with texture. It might help with some actual physical acne scarring in the skin. And we're bringing in 2 different formulas into your market, which is going to make it very easy for you to move your patients from gentle peels to stronger peels. As you look at these 2 formulas, you can see that our Sensi peel has a 6% TCA and 12% lactic. This can be used on any patient, any concern, first time peel. I don't know what to do. This is going to be the peel that is highly recommended to start every patient with. When I started first doing peels on people, even friends or family, everybody started with 2 passes of Sensi peel. And that is where I built my foundation. And from there, I went up and started changing different treatments for different people. So Sensi peel is going to be good for everybody. If you look at Ultra peel, same ingredients. However, now we have more TCA. We have 10% TCA, 24% lactic acid. So this is going to be a stronger peel, but it's really going to be an excellent peel for anti-aging skin that has seen a lot of sun, a lot of extreme photo damage, etc. We've also boosted, we have here the alpha hydroxy acid, lactic acid. There is no salicylic in this formula. Instead, we use the TCA. Blica is going to be a brightening ingredient, and then we've also incorporated alpha lipoic acid and silymarin that are very powerful antioxidants to also help with anti-inflammatory situations. So here's a side-by-side of white protein coagulation versus frosting. Frosting is salicylic acid only. You might see, maybe not this much, but you might see white protein coagulation with any peel. And it just means the peel has gone beyond the basal layer and beginning to come into contact with the papillary dermis. Okay. So Let's talk about retinol, because we're also going to be bringing in some retinol professionally, and we're going to be bringing in retinol on daily care products as well. And the beauty of retinol is that it actually converts into retinoic acid within the skin. It is the retinoic acid is the biologically active form of vitamin A. Okay, our skin will only respond to retinoic acid. The problem is not everybody can tolerate topical retinoic acid. And the thing is the side effects of retinoic acid and sometimes the redness or some of the peeling and flaking, people aren't going to use it. So retinol is a great ingredient because when it goes on the skin will convert it into bioactive retinoic acid. And everybody should be using a retinoid. It's just finding the right one for each person, because retinol does everything. Stimulates hyaluronic acid production, helps with melanogenesis and hyperpigmentation, increases cell turnover, stimulates collagen production, helps with acne. In lower percentages, it's even beneficial for rosacea. So again, one of those ingredients that are really important that we get into each person's skin that we treat. And we're bringing in 2 professional versions of retinol to be used either by themselves in a treatment room or in conjunction with any of the liquid chemical peels that are being brought in. And this is our most gentle. We can use this for every Fitzpatrick. It's a 10.5% blend of retinol with other hydrating, soothing, and calming ingredients. There will be no sensitivity on the skin when we apply this because it's a higher pH and it's more of a creamy texture. Again, you can use this on all skin types and conditions. A good pairing for melasma to start with patients that are new to peels is the Sensi peel combined with this treatment is a great kickstart to treating your melasma patients. And then we have our 4% pure retinol peel. And these come individually packaged. They look like this. And you want to use the entire package on the person's skin. And because this is a pure retinol, it is an isolated retinol molecule, you're going to get much more visible exfoliation just by itself. And then if you choose to combine it with either the PCA peel or the Sensi peel or the Ultra peel, we have seen up to 10 days of visible exfoliation. So it does come with some preparing the client on what to expect. We have 2 masks, and masks are great alternatives for people who maybe don't want to peel, or for people who might want to have their skin prepped for a peel, something to do before they have their peel. This is our oat milk mask, and you can see by the name, Hydrate, that it's probably going to be hydrating. And we've also incorporated hyaluronic acid, glycerin, oat kernel extract. And this is going to be a better mask for more of your normal, dry, sensitive skin types. What are we going to use on our oily skin types? We're going to use a Japanese white charcoal mask, which actually comes out of the container looking black. And charcoal has been used for decades to help pull toxins out of the skin. And so this mask is going to be more drying. So it's really going to be a perfect mask for our oily acneic patients. And like I said, masks can be incorporated in with a professional treatment, or they can be used by themselves. And this is our basic protocol, because many of you are probably going, okay, great idea, great product. How am I going to do these treatments? So we have protocols that are available to be used. You would simply just, we have a product called Oily Problem Cleanser. You simply cleanse the skin. You can cleanse any way you wish. Some people use cotton squares, some people use sponges. This is the most easy way to use the cleanser, is just to cleanse with a cotton square. We're going to degrease the skin and remove any debris with a product called smoothing toner. These are available both for purchase for patients as well as back bar size for you to use as a clinician. Now we're going to choose which peel to use on our patient, but the PCA peel and the Sensi peel and the Ultra peel are all applied the same way. So what you're going to do is you're going to take your peel and you're going to take a cotton square like this, fold it in half, fold it in half again, and now we have a 2x2. And you're going to take your peel and you're going to make 4 spots on your cotton square with your peel. And then you're going to do 1 more right in the middle. It's going to look like a flower, just like this. All right. This is not the color of our peels, by the way. I put food coloring in here so we can see it over a virtual training. And now you apply your peel on your patient. Now you will talk to your patient and ask your patient, how is that peel feeling? And at this time, you will determine whether or not you want to apply another pass. So this is how you control the depth of the peel. We can do 1, we can do 4. It all depends on the needs of the patient and what they can tolerate and how deeply you want the peel to go. So it's all completely controllable by you. Now, one of the benefits of not having to remove the peel or neutralize it, we're now going to customize with serums. So we're going to add whatever serums we want to add to this patient. Maybe we want to do an acne gel. Maybe we want to add hyaluronic acid to the treatment to make sure it's more hydrating. And we're going to talk about the different options in a moment that you have to not only apply these products and talk to your patients about them in the treatment room, but then what products they're going to use when they go home to continue taking care of their skin. Now you'll see step number 5 is always an option. So here's where we're either going to boost with the advanced treatment booster, which is the most gentle retinol, or we're going to boost with the 4%. And again, these can also be used alone in their own treatment. We're always going to finish every treatment with a hydrator. And the back bar version is in a pump. This is my retail version that I keep here with me called Rebalance. So we're going to rebalance the skin, and then we're going to finish the treatment with a light SPF. I don't know if you can see the light here. There it is, called Weightless. And that is very simply the skeleton, as it were, of every single one of our treatments. What is going to change depending on what you feel is best for each patient is what type of peel or professional treatment we're going to do, what types of serums we're going to incorporate into your protocol, 1, 3, 5, however many you want. And then of course, how we're going to boost, or if we're going to boost at all. We certainly don't need to boost. And boosting with a retinol, of course, is going back to the retinol story of all the benefits that retinol is going to do for the skin. So that in a nutshell is all of the professional products you're bringing in. We also highly recommend pre-treating the skin. So the patient comes in, maybe you give them a mask in the treatment room, you look at their skin, you recommend products for them to use at home before their first peel. They come back in a week later. How's your skin? It's great. Okay, let's do your peel. And now I'm going to send you home with specific products that you're going to use on your skin, depending on how long you're exfoliating, 3 to 5 days. It varies from person to person. And then they will go back to their regimen and you'll set their next treatment visit. Or you can simply create a series based on their skin condition. So a lot of people ask, Michelle, how many times a month can I do a Sensi peel? How many times a month can I do a PCA peel? It all depends on what you're treating. So with PCA's products, we treat by condition. So a normal maintenance, you know, just say your patient just wants to come in and keep their skin looking healthy, 1 time a month. Same for sensitive skin and rosacea, 1 time a month. All right. Pigment, melasma, aging skin, usually we see those things together. Every 3 weeks, you can have that person come back for a professional treatment. And then, of course, with acne, we want to get that bacteria under control. We can set them to come back in every 2 weeks. Okay, so that is a large picture of the professional products that are being brought into your market. And as they become more familiar, we can absolutely engage in more advanced education. But in the interest of time, we're going to move forward into the daily care products that we're going to be bringing in into Mexico, which is very exciting. Now, these are cleansers, toners, hydrators, and the 2 SPF products that we're bringing in. And really, when we're looking at these parts of our regimen, we're looking at what somebody likes. Do they like the texture? Do they need a stronger cleanser, or they get the oily problem cleanser? Do they want a normal facial wash? What kind of a toner do they need? So really, these are not the actual corrective products. They're things that we're going to use to round out any protocol. So I really want to spend more time on the actual game changers that we're going to be bringing in. Our treatment bars are a very unique part of PCA's products. They happen to be one of my favorites. They're very versatile. You can use them in the treatment room, but they're really effective at rounding out a protocol at home. So they're actually corrective cleansers. And they come in a jar, and it's basically, the cleanser is right there in the jar, all right? So this one we're looking at here is Blemish Control Bar. We have a 2% salicylic acid. Azelaic acid is going to help target pigment and exfoliation, and then it's got some eucalyptus oil in it as well. They come with, in the package, 3 of these sponges that look like a little disc. Get it wet, and it magically looks like a sponge. You get the sponge wet, emulsify it in the jar. You've got lots of bubbles and lots of lather. You take the lather, put it on the skin or the body, let it stay on the skin for at least 2 minutes. Personally, I will tell you, I don't like sponges. I don't like the way they feel. I like to use a loofah. So now the loofah hangs in my shower. Every day I take my loofah, I put it in my jar, put the lid back on, and now I have lots of lather to just use on my face, on my body, and then I simply hang this back up in the shower. Sponges, if you choose to continue to use the sponge with your patients, recommend after they're done using it, they store it on top of the jar. We don't want to put it back in the jar because then it turns into a petri dish. We're also bringing in Pigment Bar. So if you haven't noticed by now, we name our products for what they are, what they do, which is going to make it very simple for you as you're learning about the different products, who they're going to be best used on which skin type. So here we have Blemish Control Bar. Obviously, it's going to be very good for breakout prone skin. It's also good for ingrown hairs. Pigment Bar, it's really good for pigment. So this one is my actual favorite bar. Same process, 2 minutes on the skin. Okay, and now let's talk about spot treatments, because this is important to understand both for home care, for our patients at home, and also we can incorporate these into our professional treatments right on top of the peel. This gives you time to customize the treatment, and it also gives you an opportunity to talk with the patient about why you're recommending them to use them at home. It's a good time to educate. This is ex linea. Now, ex linea means no lines in Latin, and it has a specific peptide known as a neuropeptide. All right. So it is not Botox in a bottle. It is not Dysport in a bottle. It is simply a peptide that has a similar function to a neurotoxin, okay? The peptide lasts 12 hours. You put it on any area that you would recommend a neurotoxin. It's a great product to send home with anybody who is receiving neurotoxin in the office. And it's going to help support the investment. I don't like to, we don't say it's going to make it last longer because we don't know. All right. So it's, what are you using at home to support this investment? Hey, we've got this great product. You can put it all over where we're using our neurotoxin, or if you want to use it all over, you can use it all over as well. Recommended twice a day, okay? Because again, the peptide only stays active for 12 hours. So this is going to definitely be an anti-aging product. We have pigment gel, which again, really good for pigment, hyperpigmentation of all kinds. We have azelaic, kojic, lactic. There's also, there's a couple of other ingredients in there that I can't quite remember, but this is very concentrated spot treatment only in the areas where we have hyperpigmentation. Acne gel, it's really good for acne. So this is going to make it, as I said, very simple for you to figure out which products are going to be used for which concern. This is a salicylic acid based acne product, which is going to be really an excellent for maybe younger patients with acne, maybe your acne grades 1 and 2. And then if the acne progresses into something a little bit more extreme, into acne vulgaris grades 4 or 3, we might move into acne cream, which is a 5% benzoyl peroxide. Gluconolactone, this ingredient here, is what we call a polyhydroxy acid. So it's also anti-inflammatory, and it's going to also help with relieving some of those stronger cystic acne lesions. And then we also have lactic acid in this product. So it is a stronger product from the acne gel. We also have an eye product. And a lot of the times when patients are using eye products, we get a lot of questions with anything. Can I use this directly on my eyelid? This product is the only one that is recommended for use directly on the eyelid, and it can be used directly under the eye. In the treatment room, I might put it in the refrigerator. But what's nice about this product is it actually has an ingredient that has a little lifting effect on the eyelids. I am a big fan of neurotoxin. I have deep set eyes, so I like to get the neurotoxin that kind of gives me a lift. And this is a perfect partner to go with those types of treatments. Again, twice a day, it goes on to the eyelid very easily. It absorbs into the skin very well and does not, you know, for women who are wearing makeup and this type of thing, it's not going to create any issues. Now, I really want to spend a little bit more time on our retinols because our retinols are very unique in the market, and there's certain things that set them apart. And again, going back to the retinol story and the retinoic acid story and retinols that are on the market, many times the ones that we see are one size fits all. So here's our retinol product, good for everybody. And again, like we said before, retinoic acid is the only bioavailable form of vitamin A that works in the skin. So, you know, we have problems with irritation, or we don't take into consideration different skin types and other ingredients that they might need because retinol already does everything. There's no dispute about that. There's also the fact that it's an unstable molecule, okay? So some of our favorite molecules are vitamin C and vitamin A, but they're very unstable when they're exposed to air, light, and water, okay? So Another thing I wanted to provide for you is the actual retinol conversion when we're dealing with a pure retinol. If we have a retinol blend, like our advanced treatment booster or something that has retinol palmitate, something like this, that's a blend. When we have an isolated pure retinol molecule, the conversion has been noted. Okay, it's about a 10-fold conversion. And so as you can see here, the varying percentage of retinoic acid that is actually converted in the skin, okay? PCA's retinoids that are going home, our pure retinol formulas that we're going to discuss in a moment are at a 0.5%. So you can see once that conversion has taken place, we're actually receiving 0.05% retinoic acid that is going to be delivered in the skin with less irritation. We use a delivery system called the omnisome. Okay, so traditional delivery systems are typically like a liposome, and we're going to look at this in a moment. But the beauty of the omnisome, when we began to use the omnisome several years ago, and these are the products that we started using using this type of delivery system, we have a 10-hour delivery into the skin. So the longer we have that delivery happening, the more of that conversion that we get, okay? So we're gonna get higher concentrations of the ingredient deeper into the skin. It's gonna remain stable. It's gonna create less discomfort, okay? It's been used in the pharmaceutical, in pharmaceuticals for decades. We know that this type of delivery works, but it's relatively new to the cosmeceutical space. And here's kind of a visual of what is the difference. This is going to be our traditional liposome delivery. So you can see here it's round and all of the molecules are put right inside that round vehicle. The problem with the liposome is, in this case, it wants to be flat. So what we were finding in our earlier formulations of this is that a lot of them were opening up either in the container or in the upper layers of the skin. So not quite as effective. Our chemist at the time found the omnisome, and the omnisome is like an onion. The shape of this delivery system is like an onion. It naturally likes to stay round. And as you apply it into the skin, the layers of the onion begin to open and release those molecules slower and deeper into the skin. So this is really important to understand, because even after 10 hours, you can see what happens with the conventional delivery system. We're still kind of trying to work our way down into the lower layers of the skin. With the omnisome, we have what I call that slow and low delivery. So if your patient says, well, you know, so-and-so's retinol is 1%, why does PCA only have this 0.5%? The response to that is, it's not about the percentage going on the skin with retinol, it's the percentage going in the skin, because that's where that conversion is going to take place. So now we have a slow and low delivery of a more stable, pure retinol molecule. So that being said, again, this is going to be my favorite, brightening. Of course, we're thinking brightening the skin from pigment. So what's going to make these different is not the percentage of retinol, but the types of ingredients that we're using in conjunction with the retinol, okay? So we have retinol products that are even more tailored for each skin condition that we're going to recommend our retinol per patient, right? So here we have hexylresorcinol that helps with yellowing. We have niacinamide that helps with red discoloration, yellow discoloration, and brown discoloration. Resveratrol is highly antioxidant, anti-inflammatory, and brightening. So we have multiple things going on, okay? All in that omnisome delivery. And what is very exciting about this particular product is in 2016, the Journal of Drugs and Dermatology did do a clinical study on the finished product. Of course, they don't use the name. And as you can see here in the reference, this is a very long title if you want to plug it into the internet and read the entire study. We also have one appropriately named intensive age refining. So maybe you have somebody who doesn't have breakouts, does not have pigment, and just wants to really focus on aging concerns, because of course retinol already does that. But we have also included a patented ingredient called InflaShield that is going to again reduce the inflammation. We have a peptide that imitates retinol, so we're going to get that retinol activity without additional retinization. And orange stem cell extract that also helps with additional collagen stimulation. And then we have intensive clarity. So think of clear. We've also included salicylic acid with this formula. Now, it is known that most, I'm not sure, we can mute. There we go. So the thing with salicylic acid and retinol is we know that they both are going to work well with acne, but they don't live well together in one container. So we want to make sure that you understand that the retinol and the salicylic acid are in their own omnisome delivery. So we've kept them separate from each other in the package so that they can work together in the skin. Okay, so one more thing I really want to talk about that's important is our antioxidant product that's being brought in. Why do we want to use antioxidants? Because free radicals damage our skin. They lead to aging, they cause fine lines and wrinkles, discoloration, loss of collagen, all the things that we see happening even without free radicals as we get older. It is no secret, as I said earlier, vitamin A has been the most studied ingredient in skincare. We know it works. We figured out how to keep it stable. It does everything, but we like to use our retinol at night, right? Because it's still more sensitive to UV and it's kind of working with the parasympathetic nervous system as our skin is renewing itself. We like to use our vitamin C in the morning. Why do we want to do that? Because vitamin C paired with vitamin E creates a stronger antioxidant. Vitamin C supports vitamin E, okay? Silymarin that we've also added to this formula, highly antioxidant and anti-inflammatory. Hexylresorcinol, also brightening, helps with skin yellowing. We saw this in one of our, in our intensive brightening retinol, okay? So hexylresorcinol is also a very important ingredient. So now we have all of these ingredients, and another thing that makes this product so unique is there's no water in the formula, okay? We get a lot of questions about how does your vitamin C and E differ from other products that are vitamin C and E? It's the water. And vitamin C is like vitamin A in that it's highly unstable, okay? Air, light, and water break down vitamin C. And the way this product is formulated, it has a very tiny nose, so very little air exposure, very little light exposure, and there's no water in the formula. So that vitamin C molecule stays stable until it comes in contact with the water in our skin, and then it becomes activated, okay? So here are some studies that we did to show the stability of this product, all right? So you can see here a water-based formula versus, water-based formula versus an anhydrous or no water formula. And after 2 years, they retested the stability, and really we've only lost 0.5%. We're still at 19.5 without that water content in the skin, and just the breakdown over 2 years of competitor products. I also want to show you here, we also did some tests on skin explants, and this is a specific type of machine that measures how much more vitamin C and vitamin E got into the actual skin versus the competitor. This one is much more impressive. So this is used by a confocal Raman spectroscopy, and again on treated skin explants that shows by color how deeply the vitamin C and the vitamin E actually were delivered into the skin. And again, this is important. We need that antioxidant protection. We need the most stable delivery of that molecule that we can get. And these are, our vitamin C and E are encapsulated in a kind of silicone wrap. And the silicone also provides, once we've rubbed that product into the skin, it becomes active, it's moving into the skin. We don't want it to evaporate. So that silicone acts like a dermal patch and holds those ingredients down in the skin so they can do their job. So this is the main differentiation, is water. Air, light, and water. We protect those molecules from all of those things. And it's an extremely unique and effective ingredient. And another thing, and there have been some studies, lots of studies done on how vitamin C actually regenerates vitamin E. Because if you think about it, in the case of free radicals, vitamin E donates itself, stabilizes the free radical, but then vitamin E becomes the free radical. So vitamin C comes in, donates its electron, stabilizes that vitamin E. And this synergy continues and continues. They work well together. Another study was conducted back in 1996, actually. There's been some since then that have proven that when you have that combination of vitamin C and E in conjunction with your sunscreen, and this is why we want to use our vitamin C in the morning, is it's working with your sunscreen. We're getting a more powerful photo protection when we're using these things with each other. And a nice thing about PCA's products is, yes, you can blend them together. You can take a little bit of your sunscreen, take about a pea size of your C and E, mix them together, and then apply them onto your skin. You're not reducing the efficacy of either product when should you choose to mix them. And then we're bringing in 2 advanced correctives. We talked kind of about targeted pigment, acne, our C and E, our vitamin A. I also want to introduce you to our hyaluronic acid boosting serum. So these are more advanced. This is going to be a perfect product for you to bring into any practice that is doing filler, hyaluronic acid filler. We've got 3 things going on with this product. We have a larger hyaluronic acid molecule sitting on the skin, attracting moisture to itself. We have a smaller hydrolyzed hyaluronic acid molecule. It's going to go deeper in the skin and continue to attract that moisture and plump the skin. And then this HA Pro complex is a proprietary blend of ingredients that actually stimulates our skin's own hyaluronic acid production. So we already saw that peels do that. We know retinols do that. And now we're also adding in an extra layer with our hyaluronic acid boosting serum. Twice a day use to keep that skin hydrated and plump throughout the day. And like I said, a great partner with any hyaluronic acid filler you might be doing in your practice. And then we have our vitamin B3 brightening serum. So you can see here by the name, brightening, right? This is a high percentage of niacinamide. And we talked a little bit about niacinamide back when we were talking about the intensive brightening, pure retinol. Niacinamide has been shown to target the 3 main types of discoloration that we're dealing with when we're dealing with skin concerns. So it is going to target the yellowing of the skin, which is glycation. It's a sugaring that happens within the skin as we get older. Red discoloration, which is inflammation, and then brown discoloration, which of course is our hyperpigmentation. This would be a very effective product for you to introduce to your melasma patients. There have been studies that have shown an inflammatory component under the larger melasma pigment patches. So you're going to be able to target both things with one product. Not to say that pigment gel wouldn't be good, or, you know, retinol, of course, is a big player when we're dealing with melasma specifically, but this is a great product as well, because again, it's targeting multiple things at once, which is what we're looking for. Glycerin is hydrating. We also have some collagen stimulation with this. It also controls oil production and it protects the skin barrier. So it's really a good product for any concern. that we see. So that being said, we're about 10 minutes to the hour. And again, I want to thank every single one of you for spending some time with me and letting me introduce not only my favorite products with PCA, but products that I think are going to be excellent for you to bring into your practice. And I look forward to working with all of you in the future. I'm going to hand it over to my hosts here to see if we have any specific questions. Yeah.
Thank you so much, Michelle. It was a great talk. For sure, we are going to have more space and more, let's say, opportunities to go further and to go on deep on this topic. And I hope that we could start to motivate our physicians to use this great brand. So we are going to open the audience or open the chat in order to see if we have some of the questions, Michelle. I will start to talk in Spanish and then I will try to translate them, okay?
Okay.
Buenos días a todos, doctores. Un placer tenerlos acá en esta sesión y esperamos el grupo Auvernia que haya sido una intervención bastante motivadora para empezar a usar PCA, una línea de productos que viene definitivamente muy completa y definitivamente muy robusta para empezar a satisfacer las necesidades que ustedes tienen de manejar tratamientos específicos y especiales para sus pacientes. Entonces, si quieren, pueden escribirnos las preguntas, las vamos transmitiendo o trasladando. Sin embargo, si hay una persona específica que quiera, una doctora o doctor que quieran hacer específicamente la pregunta de viva voz, por favor, déjennoslo saber. Doctora Sara, creo que usted quiere intervenir. ¿Tienen alguna pregunta? Yes, Michelle, the question is, what is the pH of the PCA peel? Peel.
They are, give me one moment and I'll look that up for you. They are a low pH, I will say, but when we're talking about a blended peel versus one acid, pH is definitely a thing if we're talking about 30% TCA or 20% lactic acid. When we're talking about blended peels, we can deliver at a low pH, but don't have the discomfort. The PCA peel hydroquinone free is at a 1.55 to 3.85. And the Sensi peel is, hold on, give me one moment here. Sensi peel is very low, which is interesting, but again, it's a blend. It's at a 0.63 to 1.63. And then I know people are going, And then ultra peel is 0.15 to 1.15. But keep in mind, don't let those low pHs make you nervous. It's the benefit of a blend that, again, we can get that delivery without a lot of discomfort. If that were, 50% TCA, it'd be a different story. So
Exactly. So we have another question, Michelle. Thank you so much for your previous answer. Can we use acne cream and acne gel at the same time?
You could, but it would probably be best used. It's not going to be bad if you mix them together.
PCA peel hydroquinone free.
But you're going to want to maybe use acne gel during the day and maybe acne cream at night if you wanted to use them together. Because you're getting the benzoyl peroxide in one, you're getting the salicylic acid in the other. So and in my family with my children, that's what I did. We did salicylic acid during the day because it's a little bit more gentle. It's a little bit lighter. And then we did the spot treatment with the acne cream at night.
Okay, perfect. Thank you so much, Michelle. Doctora Sara Sherem wants to make a question. So, doctora, go ahead, por favor.
Hi, Michelle. Thank you very much for an excellent talk. I think it was very interesting. I've had the opportunity to work with the brand for a few months now, and I'm
good.
really amazed. I have a practical question that I do not understand.
Okay.
Why do pigment bars come in glass jars?
You know, I don't know. It probably has something to do with when they're filling them, as I understand, and I can certainly ask research and development and get back to Clementine on this. When it's poured, I think that there's a certain amount of heat, and that might have something to do with it. I honestly don't know.
Because when we're talking to melasma patients, we always tell them to avoid friction of the face because that creates more pigmentation. And the pigment bar, it comes with a sponge. So they end up frictioning their face too much. And that is always counterintuitive. Personally, what I did is I left it in the shower, it got it wet, and once it was wet, I could like separate it from the glass jar and use it like a normal bar of soap. And I've told patients to do it, but it sounds weird.
You know, another thing you can use with these, like I said, I like these soft nylon loofah things, which are not going to be too much exfoliation. The other thing is like the ultrasonic type brushes that you know, like it's not a Clarisonic, but you know, something like this that you put in the jar and then use. But yes, I understand. Yeah, and I don't know why the jar. It's something very unique to PCA. It does make it nice for travel, but
It does.
It's very valuable for that. Doctora, le voy a pedir un favor grandísimo. Creo que es una importante intervención la que acaba de hacer y el tip práctico que usted maneja con sus pacientes. ¿Nos lo podría repetir en español? Y así usted puede compartir con sus colegas esta importante información.
Lo que yo hago es que meto el frasquito a la regadera y entonces dejo que se moje y se separa del cristal y entonces ya lo volteo y lo uso como una barra de jabón. Digo, pero no sé si eso está bien, es lo que Dios me dio a entender un día que se me quedó en la regadera y se me mojó.
Pero es muy válido, incluso es válido para transmitírselos al equipo de PCA, transmitírselos y dejar claro si es algo que se puede hacer y no va a interferir con el modo de acción del producto. Muchas gracias, doctora Sara.
I just wanted to comment one more thing with what you said about niacinamide, C and E, and the retinol.
yes.
My experience with the brightening serum, you can ask Clementine because I've asked for two tubes now. It is completely amazing. The vascular component of melasma, it's one of the main reasons that causes it to come back and relapse. And even if you reduce the redness, the appearance of the pigment is much less. So it is an amazing product. For the concentration of the niacinamide, it's very well tolerated. And practical thing, I'm going to say this in Spanish so everybody understands. Lo de PCA tiene como una burbujita en el tubo que puedes ver cuando se acabó. Y entonces esto es muy práctico para los pacientes que tienen tubos y que te dicen, no sé si ya se me va a acabar, no sé si ya se me va a acabar, porque el peso no se puede terminar. La ventanita esa es una cosa muy práctica. The little window that it has that you can see the product, it is very practical.
Also, too, Doctor, if you wish to read the study in the Journal of Drugs and Dermatology, it's pretty impressive. I can't remember if it was done on aging or melasma in that point, but we've seen great strides with melasma with that product too.
Oh yeah, please share that information with us, because the more information we get, the easier it is to use and recommend the products, and the better use we make of them. And if we make good use of them, that is something Diana actually taught me. If you make good use of the products, they become good products. And the moment a product is not used by the correct hands, it becomes the bad product, which doesn't necessarily have to do anything with the product itself.
Exactly. And what I'll do is I'll send the abstract.
Wonderful. Thank you. Well, it was great meeting you. Thank you.
You too as well. Thank you.
Gracias, doctora Sara.
Gracias, Janita.
Michelle, tenemos we have another question, a very, very interesting and important question is that related to why is not needed to the neutralizers for the peeling. So this is, I think, a common question that you have time to time, and this is the one that we have here in this forum.
Yeah, going back to the blend, it's a different type of formula versus a single acid. Say you have just salicylic acid or just glycolic. Yes, they have to be neutralized. They should be neutralized because they tend to settle in the upper layers of the skin. When you have a blended formula, it's a different way to look at peels. It's very odd if you're like, well, this needs to come off. I don't know what to do. The blend itself is neutralized, one, by the hydrating components already within the skin, and two, as we're moving forward with that protocol, we're getting higher pH as we're getting thicker with each product that we're applying during the treatment. And actually, as we're going through the protocol, it is beginning to neutralize A on it by itself and B by the products that we're applying on top of it. Now, if you're in a situation where, say, you put the peel on your patient and the patient's like, oh my gosh, I'm on fire, get it off. We don't want to grab water because water will increase the activity. We want to go right to the sunscreen, skip everything and go right to the end of the protocol. And then it just neutralizes. It's very odd and very different. And if you're not used to it, but it is very simple once you get used to the concept of a blended peel. It just doesn't need to be neutralized.
Exactly, it's a new concept that it has to be, let's say,
Yeah.
the physicians get used to and their teams as well. So this is part of these kind of opportunities to let them know this information.
Exactly. And to think about it as the benefits of not neutralizing, because if you put a lactic acid peel on somebody, then you have to remove it, then it's done working. It's like a mask. Whereas if you're putting lactic acid, salicylic acid, antioxidants, all of the other ingredients that are in these blended peels, they're staying in the skin and they're working and they're continuing to work versus, all right, 2 minutes, you're done. So also try and think of these as the benefit of not having to neutralize the peel.
Exactly. Thank you so much, Michelle. Sí, doctor, esa es una de las ventajas y de las, digamos así, propuestas innovadoras de la marca, no tener que usar los neutralizadores, vienen con una tecnología que permite que el neutralizador no sea necesario, que permite manejarlo mucho mejor y que incluso permite que el producto actúe un poco más. Entonces se viene proponiendo esta innovadora tecnología con PCA y definitivamente es parte de la propuesta de valor que viene ofreciendo PCA para todos ustedes. Bueno, pues gracias a todos los participantes. Emanuel, si quieres cerrar la sesión, ya hemos contestado todas las preguntas y damos gracias a toda la audiencia, a toda la participación de los asistentes. Doy paso, Emanuel, entonces.
Muchísimas gracias, Diana. Gracias a quien organizó todo eso, por el equipo de marketing. Thank you very, very much, Michelle. Thanks to you, to Joanna.
Thank you.
And,
Gracias.
to the whole team. Thanks very much. Saludos, Berta. Saludos, doctora Alejandra. Saludos a todas las y los doctores que se conectaron, doctor Barrera. Ha sido un placer. Muchas gracias, Giselle. Muchas gracias por tus aportaciones, Sarita.
Thank you.
Y sobre todo, tenerlas y tenerlos aquí nos enorgullece. Recuerden seguirnos en el Instagram, PCA México. Recuerden que hasta mañana a las 12 se pueden seguir registrando, pero si ya estás, es que lo habías hecho, para ganar uno de los 5 kits de 5 productos, 25 productos de PCA en un sorteo que tomorrow afternoon we'll have this big tombola where we'll have 5 kits of 5 products for people who were attending this meeting. Así que muchísimas gracias a ti. Gracias por haber estado. Thank you very much, Michelle.
Thank you.
Hello to Arizona.
Yes, hello to Mexico.
That was fun to have you on board, and we wish to have you again very soon.
I hope so, yes.
Gracias a todos, gracias por su ayuda. Apreciamos muchísimo su gran apoyo y estamos conectados muy pronto con PCA Skin de Grupo Auvernia y sus distribuidores autorizados. Bye bye, hasta luego.
Bye.
Thank you very much.
Gracias.